Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, liver hemangioma. Liver hemangioma is the most common benign tumor of the liver is liver hemangioma. Most common benign tumor of the liver is liver hemangioma, which is seen in women of age group between 45 years. Here we can have two types of hemangioma. We can have small capillary hemangiomas are seen, and we have large cavernous hemangiomas are seen. Small capillary hemangiomas, actually they have no clinical significance in small capillary hemangiomas. These hemangiomas are usually single and they have less than 5 centimeters in diameter, and thus they have a there is equal incidence of hemangioma is present both in right and left lobes of the liver. And we have an entity called as giant hemangioma. This giant hemangioma means if the lesion or the hemangiomas are seen in size more than 5 centimeters, then we call it as giant hemangiomas. Then pathology of hemangiomas. In the pathology of hemangiomas, we see presence of, on microscopically we see that there is on microscopically we see presence of endothelium lined blood filled spaces are seen, which are separated by fibrous septa. So here you have blood filled spaces are present in cavernous hemangioma, and these are lined by the endothelium, and these blood filled sinusoids are actually separated by a fibrous septa, which is actually thin. So this is separated by thin fibrous septa. Okay, next. Enlargement of the hemangiomas occurs mainly by ectasia. Ectasia is by dilatation of these sinusoids will result in enlargement of hemangiomas. Then clinical features of hemangiomas. So in the clinical features, the patient is usually asymptomatic, thus they are incidentally found on imaging studies. They are found incidentally on different types of imaging done for other purposes. Large compressive masses, if they are large compressive masses, only then they cause vague upper abdominal symptoms, or else they are asymptomatic in most of the cases. This liver hemangioma is actually associated with a syndrome called as Kasabek's-Merritt syndrome. According to this Kasabek's-Merritt syndrome, here it is a syndrome which contains the two things. It contains thrombocytopenia. It is a syndrome of thrombocytopenia with consumptive coagulopathies, is Kasabek's-Merritt syndrome. It is a syndrome of thrombocytopenia with consumptive coagulopathy. It is actually rarely seen. It is associated with liver hemangioma also. Next, LFT and tumor markers are normal in liver hemangiomas. Then diagnosis. How are you going to diagnose the condition? Diagnosis is done purely on the radiological basis. That is, you do CT scan and MRI, which is diagnostic. On CT scan and MRI, you will see presence of peripheral nodular enhancement pattern is important for liver hemangiomas. Here there is peripheral nodular enhancement pattern is seen on CT scan and MRI. If the diagnosis actually percute, because actually it is a sinusoidals, right? There are blood vessels, ectatic or dilated blood vessels or sinusoids are seen. So if you try to do a biopsy, then it is contraindicated, because biopsy is dangerous. You can even puncture the sinusoids, resulting in life threatening hemorrhage, and thus biopsy is contraindicated and it is not recommended in patients with liver hemangioma. Then treatment of hemangioma. In liver hemangioma, if the patient has observative, if the patient is asymptomatic, if the patient is asymptomatic, observation can be done for asymptomatic cases, whereas in for symptomatic cases, enucleation is the treatment of choice for symptomatic cases.
thank you and thank you for watching.